Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location in Falls Church, Virginia, discussing dental implants and how they can help restore your smile and improve your dental health with one of this area's top dentists, Dr. Mansour Mortazie. Dr. Mortazie received his dental degree from Howard University and is a fellow of the International Congress of Oral Implantologists and is widely recognized as one of this region's top dentists. Welcome, Dr. Mortazie.
Glad to be here. Thank you.
Oh, it's our pleasure to have you on. We've got a lot to talk about regarding an important topic, dental implants and how they can benefit so many folks. I understand there's a patient that's going to be joining us a bit later, some before and after pictures as well that we'll get to. But before we get to all that, I wanted to begin by asking you if you can please tell us what dental implants are.
Well, dental implants are a permanent solution for missing a tooth or multiple teeth, and they are the better alternatives because no other teeth has to be altered in order to replace a tooth. So it is the best alternative above all the other options.
Well, that's certainly good to know, and you also mentioned a key word in there that caught my attention, and that is it's a permanent solution.
Yes, it is.
That's very good.
Yes.
Now, are there different types of implants, doctor?
All implants are made from a surgical grade titanium. The only difference is in their shape, specifications, screw type, different designs and forms, which each company has a specific design for themselves.
What types of problems do these implants correct?
Implants are replacing the root, missing root of the tooth. Okay. And then the rest of the restoration or whatever it is would be built on the implant. So they are only replacing the root and missing root or roots of the tooth.
Well, that's very important to know because I would imagine that without the root of the tooth, obviously, there's no restoration that can take place. Right. So this is the important function that a dental implant provides, among others, is that it actually replaces the root and then the restorative work can happen after that. And who would you say, Dr. Mortazie, is a good candidate for dental implants?
Well, any person who is missing teeth or tooth or teeth that wants to eat favorite food and improve their chewing ability and self-esteem and speech and appearance, they're the candidate for dental implants.
I would think that would be quite a few folks out there.
Yes.
Now, can you please describe briefly the process that a patient would be looking at from when they come to your office regarding getting dental implants? I know, I'm sure, it would vary based on patient to patient how much work is going to be needed. No two patients are alike. But with that being said, just in a general sense, what can you tell us?
Well, the dental implant can be placed immediately upon extraction of a tooth or a period after the extracted tooth. By a small incision, we can place that inside the bone, and after a short period of healing process, then the root is ready. If the bone structure is also deficient or missing, there are various type of bone enhancing process that we can do. It varies, depends on the necessity of the enhancement, and can be done, and after that the implant can be placed.
So would it be safe to say anywhere from a few weeks to a few months based on, or a bit longer depending on the particular patient?
Yes, it is anywhere between 3 to 6 months.
Okay.
Or if they need any bone enhancement process, about a year or so.
We're now going to meet a patient of Dr. Mortazie. Welcome, Nancy.
Thank you.
Oh, it's our pleasure to have you on. We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, Nancy, I'd like to begin by asking you, what dental problem or problems were you experiencing prior to coming to Dr. Mortazie?
Well, I've had several dental issues. I've had crowns, root canals, TMJ, and grinding my teeth at night.
My goodness, a number of problems before you came here.
Yes.
And I'm sure they were affecting your life. As far as what you just told us, TMJ is neuromuscular problems with the joint and the jaw and the other issues that you had as well. I'm sure they were affecting your life.
Interestingly, I have had some neck injuries, which I thought were making my neck constantly sore. Dr. Mortazie and I had talked about this, and we tried to treat it with using a nighttime mouth guard. After we tried that, we then moved on to recapping all of my teeth, which returned them to their normal and appropriate size, and that really made all the difference in the world.
Well, I'm certainly happy to hear that. And how long did that process take?
I think the whole process took about a year.
Okay. In different phases, basically?
Yes.
You're obviously very happy from the smile.
That's correct. My neck pain has all but disappeared since I had the procedure done. I really feel terrific, and I'm going forward.
Well, I'm so happy to hear that. You must feel like a new you, right, so to speak?
I really do. I do. I've been able to return to the sports activities that I was participating in before. I can now turn my neck more freely from side to side, and I even feel more confident about myself and about being able to smile.
Oh, that's wonderful. And lastly, before I let you go, Nancy, for the viewers that are out there watching right now, what would you tell them about your experience with Dr. Mortazie and his wonderful staff here?
I would highly, highly recommend Dr. Mortazie and Donna and their wonderful office. Dr. Mortazie is an extremely confident and competent dentist. He's very compassionate, and the care could not be better. I would recommend this place, this office, to anyone and everyone who needs dental care, from tooth cleaning to dental implants. It's just the best.
Well, on that note, I'd like to thank you, Nancy, for coming down, sharing your experiences with us, and being a guest in our program.
Thank you so much. It's been my pleasure.
Oh, our pleasure. We're now back with Dr. Mortazie. I must say, Nancy seemed very pleased with the results.
We have many patients who are appreciative of our work, and that is to my pleasure, and that's what keeps us happy and rewarding to me, to see the happy patients.
Well, I'm certainly happy to hear that, Dr. Mortazie. Now, as far as the results on average are what Nancy just experienced, is that pretty much what most of the results we can expect from these dental implant treatments?
Yes, I can assure you that generally the dental implant do not decay, and it's easily, by brushing and rinsing, there will be less maintenance than the natural tooth, and they are working real well. People who have a loose teeth, grinding their teeth, and they are very mobile, have put implants in the mouth that they are more stable. The adjacent teeth, the natural teeth, gets loose and they have to replace it, but the implant has been solid, and that's really important.
Yes, indeed. Now, are there any follow-up visits for the patient after the implants have been placed that they would need to come and visit you regarding?
Well, for the restoration and making sure that everything going right, but not necessarily for the restorations that need necessary to do on the implant, but not, as I said, it is less maintenance on the dental implant than the natural tooth.
Very interesting. Now, we're literally out of time, Dr. Mortazie, and I wanted to ask you before I let you go, you and your practice here in Falls Church, Virginia, have established a reputation for excellence in not only dentistry, but certainly specifically implant dentistry as well. And I wanted to ask you, what would you say separates you and your practice apart from many of the others around here?
My belief is that everyone deserves excellent oral dental health because it affects the general health of individual and emotionally increases the self-esteem and overall health of the individual.
Yes.
I use experience, technology, and artistry, and with a lot of care for every patient who comes to my office. And pretty much we get a good result and a satisfied patient.
Well, on that note, I'd like to thank you, Dr. Mortazie, for joining us and being a guest in our program today.
I'll be glad to be here. Thank you.